verdadero, vamos pa'lante. Yes, sir.
Have you ever been in doubt, trying so hard to figure it out? I spent many days lost in myself, drowned in this world, had to reset. I never ever go back to that again. Say I gotta get up and get on my way, leave the negativity way behind me. Say I'll never settle for less. Sometimes it seems that we gotta lose it all before we can see that nothing lasts forever. Risk it all for love. Love is from above, and all my life is for you. So I'ma live it up.
Siempre real y sincero, y sincera es la música.
I'ma live it up.
Con amor verdadero, vamos pa'lante. Yeah. Y líbrate la mente, líbrate la mente. Y grita lo que sientes, grita lo que sientes. Líbrate la mente, líbrate la mente, líbrate la mente. Con amor verdadero, vamos pa'lante. La vida es lo mejor sin poner interrogante. Vamos pa'lante, mi gente pa'lante. La vida es lo mejor sin poner interrogante. Siempre real y sincero, y sincera es la música, no se detiene. Siempre real y sincero, sincera la música, no se detiene.
Sometimes it seems that we just gotta lose it all before we can see that nothing lasts forever. Risk it all for love. Love is from above.
Hi, good evening, everyone. So, welcome to the program Happy Empathy Hour. And it's me, myself, Mashal, and Pam in the studio, and you're listening to the program Happy Empathy Hour.
And we're smiling, aren't we?
Yeah. So how are you doing, Pam?
I'm a lot better than what I was, though. I know we're running a bit late anyway.
Yeah.
So, how you pronounce it, this technology today?
What? Which one?
Technology.
Oh, technology.
That's what it says.
Yeah. So, how do you feel today? How are you doing?
Well, I got one more hospital appointment next week to see at the Queen's Medical Center again.
Okay.
But I promise this time I won't go and wind up the doctors and nurses and ask them to come on my program. So it'd be nice to have them on again. But apart from that,
excellent. So, to the audience and to the listeners, we want to announce that we are welcoming our guest today, and this is all because of Pam, and she wants to have a nice, conversation. It's going to be a very informative show today about health and winter. We have a guest, Deputy Director from Nottingham Hospital, University
I know
Hospitals.
where that is.
Yes, and we have another guest with us, Tracy Kane, if I'm pronouncing the name right?
Yeah.
Deputy Chief Nurse from Nottingham University Hospitals.
Yeah, it's nice for them would like to come on the show anyway.
Yeah.
But as I said, I can talk about the NHS.
Mm-hmm.
Yeah, because they had to check me out as well and the radio station as well.
Right.
So it's been nice to get them involved.
Right.
And I can talk about my personal experience as well.
Yeah.
And,
So everyone knows the winter is around, and we have a lot of issues, challenges along with it when winter comes. Though it's very beautiful weather, snow has been falling. Have you experienced? I love snow. How do you think? Let me first check if we have the guest in yet or not. Hi, good evening. I think yes, we have Tracy Kane and we have Mark Simmons. So you all put together here.
they all put together, didn't
Yes, they put together. I think there was some issue with Mr. Mark's camera. Is it?
Yeah, I hope you can.
So they are together. That's
they?
excellent.
Right.
So first of all, good evening and a warm welcome to our show. And thank you for taking out some time for us, Mark Simmons. He's a Deputy Medical Director from
Yeah.
Nottingham University Hospital, as I mentioned, and Tracy Kane, the Deputy Chief Nurse. And we're going to have a very good conversation today, right, Pam?
I like the way you said a very good conversation. Yeah, it's nice to have you on our program. Thank you so much.
Yeah.
No problem. It's good to see you. Hope you can hear us.
So, good evening. Can you hear us? And if you can speak, so we can test the mics if it's working fine.
Yeah, we can hear you. Can you hear us?
Excellent. That's fine. We just tested the mics and everything is fine. All right. So, first of all, how do you find now the winter, the snow? Everywhere is around. And last week we experienced snow, and it's an early snow in UK, right? So, thank you for.
Ask if we can get a little bit information.
Yeah.
Yeah.
So, please, first of all, like, can you tell us about your role as, of course, the deputy nurse and deputy director for our audience to know, and how it is like with the, and what are the challenges and pressure what you're facing with the winter, especially right now?
Okay, hi, and thanks very much for allowing us to come and join you this afternoon. So we're really starting to feel the winter pressures from our patients' perspective. It started to sort of speed up in terms of admissions into the hospital, and we generally follow patterns of other countries, and we are starting to see an increase and uptick in terms of patients experiencing flu coming into the hospital, and a little bit of COVID in terms of just that exacerbation of how people feel during the winter months. And particularly over the last couple of weeks, we're really starting to see that sort of becoming an increasing issue for us here in Nottingham University Hospitals and around actually the region and nationally. So it's not just here, it's really been quite a challenging period over the last week specifically across sort of nationally.
So again, it's nice to see you this afternoon. So Tracy and I are senior clinicians in the management of NUH, and so we have an oversight of how the hospital is running at any one time. The reality of winter is a number of factors come together: viruses, the weather, and sometimes even events that bring lots of people together and then spread those viruses can have effects on the hospital days and weeks following them. So we're watching that really carefully, and this year planned ahead as we always do, but this year especially because we know that this winter is going to be tough.
Yeah.
And also it's going to take a massive effect, especially on pensioners as well, with the underlying condition as well. And if you also notice with the weather as well, a lot of the houses are getting damp. And there is mold growing out, and it start affecting younger kids and elderly as well.
Yeah.
How you think you're going to deal with this kind of?
Yeah, it's quite of challenges and like it's struggles, especially for the vulnerable you mentioned. So what we just want to know, what is winter like your NHS resilience plans for all these challenges, which is the people are going to face right now, especially there are homeless, they're vulnerable, they're elderly people, and the children, of course.
So the NHS is under pressure, and it has been for a long time. And I think all of the factors that you've described are all contribute to that. We've got to recognise that as the weather gets colder, it's not just the viruses, but it's everything on top of people's housing, where they're living, who they're living with, or the way that society is functioning that affects their health. Now, we have a very big hospital. We've got the Queen's Medical Centre and the City Campus, both of which have a total of over 1,600 beds. And the question is how we use those beds most effectively during winter time. What we're trying to do is to reduce the number of people in those beds who perhaps no longer need to be there. So we absolutely are here if you're sick and unwell, but we're going to try and keep your length of stay to as minimum as possible. Now, some of that is about ensuring that we get people back home to care homes or into care packages where that is necessary as rapidly as we possibly can. But also, you might find yourself actually suggesting that actually you continue that acute care in your own home, whether that be through what we call same-day emergency care or virtual wards, where we continue to keep an eye on you and be able to ensure that you get the care that you need, but actually you're sleeping in your own bed, which many of our patients actually prefer. So if you need to be in hospital, you need to be in hospital, but we will make sure as much as we possibly can that our hospital is being used for those patients who really, really need to be here, because no patient wants to be here over Christmas or over the winter period.
I think, and just to follow up, I think working closely with our social care colleagues in terms of really trying to understand from a patient perspective how we work together to get them back out into either their home environment or the next best place for them while they continue their recovery. So we do work as a system and work as a group of colleagues across that whole patient pathway to try and find solutions together, so that we are working together as a system, not just individual organisations, and hopefully that has a beneficial impact for patients.
Yeah. But one of the issues we're going to have, I'm talking all over the country at the moment, is when we go in hospital, a lot of us is going to go home and there's no one there to support us. You got family, but sometimes family don't want to actually do anything for the elderly. Who is going to help us to support you and get them back in their home?
That's a really, really good point, and actually one of the main areas of communication we're trying to get out to the population, that we need your help this winter. The NHS needs your help this winter, and so if you do have a family member in hospital, please work with us to try to get them back home as rapidly as possible. Of course, if they need social care support or health support when they're back in their own home, we will ensure it's in place. But it's simple things, making sure that the house is warm, that there's milk and bread in the fridge, that the keys are available. Simple things that actually, when someone is in hospital, they're fairly they're quite helpless in those ways. Family members and friends and neighbours coming to help, to understand how we can get that patient back home, not only means the patient gets back to their home environment, but also helps the NHS, because there will be someone on an ambulance or on a trolley or sitting in the emergency department who needs that bed. So we are asking the public and the community to work with us over this winter to do the best they can.
Yes, it's an important thing, because an important message is passed on, because the community collaboration is very important here.
And family and friends.
And family and friends, of course, they have to move forward and assist. Because, NHS is, of course, we, as the flu patients and all the patients increases, will be overloaded with, so many things. The staff strength also. And the people taking care of all those vulnerable and of course, the elderly. And so many people's you must be having a lot of patients challenges like asthma and all those things, diabetes patients and all those patients, everything, like along with this winter, right? Pam, you want to add something on that?
No, I'm waiting for to respond to that.
But sure, I mean, winter is a time of particular peaks in certain issues, respiratory conditions, but also those trips and falls that happen on the ice. The fact that the cold does change people's patterns of activity. It all changes the presentations that bring people into hospital. It's not just there's more people coming in winter; it's how sick they are. And that again affects how long people need to stay in hospital and the pressures that are in there. Just going back to the previous point, of course, there are fantastic community groups out there, and you're right that family and friends are sometimes many miles away and struggle to help. But again, the NHS has got good links with some charities and care groups and community groups that can help individuals. So we're very open and willing to work with people to work on that sort of scale.
Okay, I can hear where you're coming from and see where you're coming from. Non-emergency, do you agree that walk-in center as well is available for them? If a non-emergency, because we do have walk-in center where they can go instead of taking up the space in the hospital.
Absolutely. I think it's really important for patients to really understand all of the options available to them in terms of their GP, their pharmacy. Local pharmacists are hugely informative in terms of supporting people with, you feel, very terrible and you go and see your pharmacist and they can absolutely support you. The walk-in centres that we have on London Road has got, you know, is open all day until 7 o'clock in the evening, and really supportive in terms of getting the right number of right help, using 111 in terms of really also getting support in terms of where is the right place to go, and then clearly there's the emergency department for those very things that are considered life-threatening, and that's where to attend there. So it is really about lots of options for people, and lots of those options are very close to home, in terms of not having to travel to the ED department and across the city. So it's really using all of those resources and those expertise really is really key for you to get the care that you need as soon as possible.
Okay, I agree with you. There's one thing a couple of things I would like to say. I talk about the NHS regularly on the show.
Yes.
What I would like to say to the listeners and everybody out there who is listening, the staff at the hospital are not there to be abused. And they do get a lot of abuse as well, whether they're drunk or something. They're there to look after the sick. So please do not abuse the staff.
The staff dignity and respect is very important. And they are all going through the stress and pressure, taking care of not just one, so many patients in the hospitals. So that is a very important point. Yes, you have put across many times. Yeah,
because we're so very lucky to have the NHS.
Yes.
Yeah, I can speak for myself.
Yeah.
But the abuse, I don't think it should be tolerated.
No.
What is your opinion on that?
I really appreciate you raising it in that way, actually, because it is something that we do experience quite a significant amount of. And we really understand that patients, when they come into the hospital, are at their most vulnerable. But we cannot tolerate our staff being spoken to or physically assaulted when they come in. So I really, I really appreciate you raising that. Now we do not take a tolerable approach to it. So we will absolutely take as much action as absolutely we can. We will engage the police. We will have conversations about asking and supporting our staff to really escalate that and take it seriously. I think it's also, notable that we support patients who do not and are not aware that they are being violent and aggressive. So it is to differentiate from those patients as well. So patients who are very clinically unwell, who may be very disorientated or may have dementia, for example, and we're not talking about those patients. We can support those patients in a very different way by de-escalating and managing them. We're talking really about the patients who come in and because they are not happy with the length of time or because they're not happy with the decisions that are made, are aggressive and violent, and it's very important to us to support our staff at all times to not accept that as being tolerable behaviours. But I really appreciate you raising that, because it is very difficult for our staff to manage, and when we do take a very proactive approach to try and address it every single time.
Yes, we appreciate NHS support, what they're extending to the patients. And Pam has been always raising in her show about the staff, protections, and they're not abusive. No, not anything abusive towards the staff, because staff is also going under pressure and everything. And what you mentioned is also excellent. You're dealing with all the patients case by case. Yeah, how different the cases are.
Well, I'm at the hospital at the Queen's next week. I promise I'll be.
You have to be a good patient.
I won't, let them laugh as much.
Yeah.
But I do appreciate the NHS.
It's doing extraordinary.
They got a family of their own as well. They got staff to look after, as your CEO, Mr. Salmon, as well.
Yeah.
So it was nice. It's, just because we're very lucky to have the NHS.
Absolutely.
Yeah, compared to some country, you have to pay for your medicals.
Absolutely.
Or your tablets. So let's appreciate and support him.
Yes.
Right. The two guests, I'm not going to call the two guests' name. I'm going to be myself.
Yeah, because it's like NHS, what is doing is extraordinary around the world, what I know.
Yeah.
And the service, because last time my mother was in QMC when she was admitted, and she's asthmatic patient, and the service and everything, how they take care is something extraordinary. So it's remarkable, and we should appreciate we should appreciate
Yeah,
is each and every staff, the nurses from small to top to bottom, or bottom to top. I'm sorry, we have a commercial
without a
break,
commercial break.
and we will be right back.
हाँ भाई, तो फिर आज रात को पहुंच रहे हो ना?
तुम्हें पिक करना पड़ेगा।
क्यों, तुम्हारी गाड़ी को क्या हुआ?
यार उसका एक पार्ट नहीं मिल रहा।
ये तो एक बहाना हो गया।
नहीं, सही कह रहा हूँ।
और मैं भी सही कह रहा हूँ। A to Z कार पार्ट्स के होते हुए ये नामुमकिन है कि आपको अपनी गाड़ी के लिए कोई पुर्जा न मिले। ब्रेक पैड्स, एयर फिल्टर्स, स्पार्क प्लग्स, ऑयल फिल्टर्स, अल्टरनेटिव्स, बैटरीज, हेडलाइट्स, रेडिएटर्स, टाइमिंग बेल्ट्स, फ्यूल पंप्स और बहुत कुछ और सब कुछ। किसी भी गाड़ी का कोई भी पुर्जा, A to Z कार पार्ट्स, 509 Alfreton Road, NG7 5NH. Call us on 0115 845 1832.
Through your hands, we can shape the future. By supporting an orphan, by quenching someone's thirst, by empowering people through life-changing livelihood projects, by responding to those in urgent need. The future lies in your hands. Muslim hands, united for the needy.
अगर आप सोशल हाउसिंग में रहते हैं और कोई मसला हो तो शिकायत करने का तरीका जानें। मरहला 1, अपने लैंडलॉर्ड को बताएं। अगर ये फिर भी हल ना हो, मरहला 2, अपने लैंडलॉर्ड को शिकायत करें। और अगर आप उनके जवाब से खुश ना हो तो मरहला 3, हाउसिंग ओम्बड्समैन को शिकायत भेजें। वो इसकी मुनसिफाना तफ्तीश करेगा। एक महफूज घर का होना सबका हक है। अपने हुकूक जाने, मुलाहाजा करें gov.uk/social housing.
There is a reason why we do what we do. Time disappears and seeing the world just becomes a dream. But it doesn't have to be this way. Whatever your destination, it's waiting for you. From perfect getaway holiday packages to bespoke deals, Nottingham Travels is the UK's leading travel agent. You're in safe hands.
हज और उम्रा की स्पेशल ऑफर। इसके अलावा पाकिस्तान जाने के लिए टिकट्स अभी हासिल कीजिए। और हाँ, मनी ट्रांसफर की सहूलत भी दस्तयाब है।
Visit us at 161 Radford Road, Hyson Green, Nottingham, NG7 5EH, or call 01159 787 899. Check out our website for fantastic offers and unbeatable deals. www.nottinghamtravel.co.uk.
अस्सलामुअलैकुम। सर्दियों में फ्लू और कोविड-19 ज्यादा आसानी से फैलते हैं और आपको सख्त बीमारी का शिकार बना सकते हैं, मगर फ्लू और कोविड-19 की वैक्सीन बहुत बड़ा फर्क ला सकती हैं। ये आपको महफूज रखती हैं और बीमारी से बचने में बेहतर तरीके से मदद करती हैं। इसलिए अगर इन सर्दियों में आपको ये वायरसेस लगते भी हैं तो आपको हल्के सिम्टम्स होंगे और आप जल्द सेहतयाब हो जाएंगे और आपके हॉस्पिटल में दाखिल होने के चांसेस भी कम हो जाएंगे। अगर आप प्रेग्नेंट हैं या आपको कोई लंबी बीमारी है जैसे कि सांस की बीमारी या फिर लंग्स, किडनी, लिवर या कोई दूसरी बीमारी, या फिर आपका बच्चा 2 या 3 साल का है, तो आप अपनी एलिजिबिलिटी चेक करें और अपनी वैक्सीन nhs.uk/winter vaccination पर ऑनलाइन बुक करें। वैक्सीन हासिल कीजिए और अपने आप को मजबूत कीजिए। शुक्रिया।
Nottingham's #1 station for the community, by the community, Radio Dawn.
Siempre real y sincero, de Copenhague hasta el Caribe. Siempre real y sincero. Oh, yeah, dímelo.
Say I never.
So, welcome back after a commercial break. You're listening to the program Happy Empathy Hour with Mashal and Pam today. And we have today with us Mark Simmons, Deputy Medical Director from Nottingham University Hospitals, and Tracy Kane, the Deputy Chief Nurse, with us from the, of course, Nottingham University Hospitals. And we are talking on a very informative subject and valuable insights they're giving us, what we have to take precautions and what NHS is providing services. So welcome back, Director Mark Simmons and the Chief Nurse, Tracy Kane. Yeah, thank you for your time and thank you for patiently waiting for us during the commercial break. So
can I ask you a question? And Michael and Tracy, Yeah. You know I'm up there next week. Yeah. Would you like me to come and sign your autograph for you?
Definitely.
I'm
Most
a vascular.
definitely.
Can you hear us?
Yeah, most definitely. Give us a shout when you're on site. Would love to catch up in person.
Yes, definitely. They are
Right.
a celebrity now.
Yeah. You know, the other issue is when you look at it as well, a lot of people now is complaining about the cost of living. They cannot keep their eating on.
Yeah.
They cannot buy food. They can, even with kids now. Are you going to see a lot of that as well during the winter months?
So I think we have to accept that health is related to all of those issues, and as I said earlier, winter tends to bring people indoors, and you mentioned earlier poor housing, damp, not keeping the heating on, not necessarily having a nutritious diet. It all contributes to people's underlying health issues, and when they then get an infection or something happens, all of that is important to how well they can recover from that issue. So you're right. We do occasionally have people coming in with quite simply care issues, caring for themselves and because of the environment that they're living in. But I think it's more to do at this time, especially over the last few years, as the cost of living has become such an issue, that it's the underlying health that is affecting how long and whether someone needs to come to hospital, but also how long they stay when they come. So you're absolutely right to bring it up, and the NHS has to live within the environment that it works in, and so we're very keen to understand what's happening in our population, what's happening with the city of Nottingham, but also the county as well, just to understand what our patients are going to need in the years to come.
Right, not just about the patient. What about the staff? Because the staff, they're going to be underneath pressure as well. Yeah, they're going to think about their health as well. Staff are going to go off sick. How is it the NHS is going to cope with all of these?
I mean, it's a really good point, and it is really important for us. Good patient care is delivered by staff that are safe and happy and healthy as well. Here at NUH, we have quite a large staff wellbeing programme, and we really try and address some of those challenges. But there's always more to do, and there's always people that are struggling and that we don't know about. You know, we're a massive organisation, so we do try and really address those things and try and support our staff in terms of how it feels to come to work. There's lots of schemes and lots of sort of pieces of work across the whole trust. But we're really conscious of the fact that in order to deliver really good care to patients and families and carers, you need to be in a good place yourself in order to be able to do that well. So it is something that we look at, and it is something that the teams look at in terms of really trying to make sure that we're maximising the support we can offer people. It's a really big challenge. And we have, like I said, a huge number of staff to be able to look at, each having different challenges and different things that are happening in their home life. So it is something we try and look at really sort of from their perspective as well, and address it and try and work and support with them on it.
So we've got 19,000 staff across the two hospitals, and you know that's a substantial part of the population. So the problems that our population have is also completely reflected in
that's a huge number.
And so it's really important for us to recognise those issues, as Tracy says.
You know, I go to the city hospital and I go and cheer the staff them up as well, you know, especially when they eat and not sharing their food with me. So I go like I stomp my feet like a little child.
You're so sweet, Pam. You're so sweet always.
And I do go. I would like to know if I could come on. I've got caring background. I was a manager for a care home, community care as well. I would like to try and come and do some voluntary work, especially in emergency, and take some of the pressure off as well. How would that be something you'd be interested in?
Yeah, we've got a really vibrant volunteer programme here at NUH. So there's definite opportunity for people to become involved and engaged in that work. And we have a really healthy and thriving patient experience group as well. So there's lots of opportunities to come and support. We can share those links with you off air if you like that. And definitely, Pam, when you're here next week, make sure you've got our contact numbers and definitely give us a shout. It'd be really nice to have a catch up and just see what you want to do. But we'll definitely.
So
She's always so kind and sweet. She is always caring about.
So next week when I come on the 2nd, I'm going to see both of you. Yeah.
Yeah, for sure.
So we would love that. Actually, you know, the if you go to our website, which is www.nuh.nhs.uk, there's a whole section on how to sign up to be a volunteer, and we want to have a really diverse and community focused group of volunteers working for the hospital. Again, it brings the outside in. A hospital can sometimes feel like a bit of an enclosed environment, but actually volunteers and our staff coming from all over our community and from such, I mean, Nottingham is such a diverse city. We would absolutely welcome that, and our volunteers do a phenomenal job.
Yeah, they do.
That's something we could talk about and get people to involve.
We should talk openly more about on our shows about, and to just do, because it's actually the staff, when the staff is getting either viral or they are falling sick, you will be facing another challenge of having a shortage of staff. So it's better to have the prevention, the care, and you need more volunteers to assist, than
and
NHS team.
also with communication problem as well. What do you think? What is your view on those, Michael?
Sorry, say that again. I missed that.
She's saying that if the communication problem, there could be a communication gap, you're trying to say, right? Yeah. So how do you manage that, or you can have a solution to that?
Yeah. So you're thinking about, you talk about interpreting and people with different backgrounds and languages.
Yes, the culture and backgrounds. Yes.
So we have. So as I said, Nottingham is an extremely diverse community, and we want to reflect our community in the hospital. So many of our patients come from many different countries with different different languages, different needs, different religious beliefs. And actually having staff and volunteers who match that and can understand and help us all make sure our hospital is absolutely fit for purpose for our entire population is such an important part of what we need to do. So we would absolutely welcome ideas, people, thoughts around what we can do differently and better on that. But it shouldn't be a barrier. It's not a barrier to helping us. It's not a barrier from our perspective. And we'll do.
Communication barrier is taken care of. That's taken care of.
The communication barrier with me, you sometimes it's very hard.
But we go over very well. We understand each other.
Yeah.
So what is what advice would you give to the individuals who are struggling with the balance of heating and homes and others, so many issues they are facing? So what it could be better they can take care, instead of having the sickness, and it's like prevention is better than cure. So always so always, what you could give an advice to the, of course sometimes it's a virus, we can't help it, but and we have to fall sick, of course. So but there has to be preventions can be taken by people with asthma and so many other sicknesses.
I think for everybody who is eligible, please get your COVID vaccination. Please get your flu vaccination. I can't stress how important that is, particularly for people who've got an underlying condition such as asthma and other respiratory illnesses, and really try and do that early prevention. Try and keep yourself as well as you can. Use your local pharmacy for information in terms of sort of that preemptive sort of approach, so that actually you aren't becoming unwell, and really making sure that you do your best to eat as well as you can within the scope of what you can do, that you keep as warm as you can, and that you are not sort of heating an entire house if you don't need to, and really just trying to take some really sensible and practical practical approaches. You know, when it's icy and it's really slippy out there, you know, think twice
Yeah.
about, you know, legging it down to the local shops if you don't need to, and using your community resources to try and support you. And there's a vast range of people, isn't there, in age in terms of what they need to do at any given time. But it is really the simple things that we all do when the weather gets cold and gets difficult. But the vaccination, I think, is a really sort of big piece. And we have done work in the past around people who are really sort of worried about getting a vaccination, particularly around those people who are scared of needles. And local pharmacies do an incredible job, and local GP surgeries and primary care surgeries, an incredible job in supporting people to access that if they're worried about it. And I really encourage people to really think about it this year if they've never thought about it before, and if they've been, you know, reluctant to do it before. Maybe this is the year that you get some help and advice to get that done. But really just taking some simple measures.
Yeah, because the pharmacy can do some of those things as well.
And supermarkets.
Yeah, absolutely.
So we have actually got some intelligence that flu is probably going to hit quite early this year. So sometimes people think, oh, you know, I'll leave my vaccination for a few weeks, and I'll leave it till Christmas. And it's like, well, for this year, the earlier the better. You know, there is we want you to take that opportunity, and it is so accessible. Just just Google flu vaccination in Nottingham, and there'll be lots and lots of places you can get that. Many people get it free on the NHS anyway, so if you do have an underlying condition, your GP will be able to help you with that. Yeah, my wife's going down to Asda going to Asda tomorrow to have hers done, so there's no reason not to do that.
Yeah, it's quite a good, you know, quite an enormous job for an NHS to do and handle. But are you? I know that NHS is doing for schools as well for children, right? The vaccinations, or no? It's just
so
the pharmacy.
The flu vaccinations will be done through local schools as they've done it in previous years. I've just signed my daughter up for the flu vac, and it's just really important, and it just makes a difference in terms of if you then do go on to have a respiratory illness, it won't be as bad as it would have been if you'd not had your vaccination. And I think it just stops you becoming really unwell, and it's really so important for those patients of all ages who have an underlying health condition. It's absolutely, you know, the number one thing for them to really consider and do differently.
And again, just thinking about children, one of the things we've introduced this year is the RSV, what's called a respiratory syncytial virus vaccination. That's it's a massive problem for young kids. Something called bronchiolitis can happen as a result of that. And we have, in November and December every year, we have tens and tens, if not hundreds, of children arriving at the hospital with this virus. It doesn't tend to cause really severe illness in most people, but in some kids it can be life-threatening and actually put people on high dependency and on intensive care. What happens then is that virus then circulates in the whole of the community, and then adults and more elderly people then get that virus and then come in and have with other problems. So it's not just about the kids, it's not just about our elderly people, it's about the whole population looking after themselves this winter.
Yeah. And also, you know, as I said, emergency for the hospital, we got walk-in center, non-emergency can go there. We need to think about taking some of the pressure off the staff them at the hospital, because they're going to be busy.
Yeah, because it's extraordinary and it's tremendous things. It's a lot of things on there, you know, it's in their plate. So but they're doing a remarkable job.
Yeah,
I must appreciate, and NHS is doing a remarkable job.
But as you heard, even in the paper, the NHS is always blaming the NHS not doing this, the NHS not doing that. But what about the thank you for what the NHS is doing? You know, the people, the nurses and the staff go out their way to look after us, you know, so let's give them a thanks.
Of course, definitely.
I'll give them a big hug when I see them next week.
From my side as well. From my side. Yes, from my side as well, because I truly believe that NHS is doing an extraordinary job, and it's so many things, and, you know, it's not just one, schools, elderly, and the patients, and
Yeah, but we're human being, and we're going to
yeah.
moan about everything.
Yeah.
You know, so if it's not an emergency, please go to the walk-in centre. There's one on London Road in Nottingham, and there's one on Derby Road as well.
Yeah.
So we need to protect what we've got, because I think not we got the NHS. Country hasn't got that.
Yes.
So we need to respect the staff, even the ambulance crew and everybody else. They're not there to be abused.
Yeah.
So I think
just imagine what challenges. Yeah. Please.
I
Go ahead.
think a lot of what we're talking about is helping us to help you. That simple message would hugely help us. And whether you're talking about the respecting of staff, or getting your vaccination, or thinking carefully about where you seek your healthcare, it's all part of the story. And we sometimes get it wrong. And I think we have to accept that the NHS is not perfect. We do get things wrong, and we need to know when that happens, because then we can learn from it and move on. But there is a degree to which we are working with what we've got, and we're doing our very best for you. Let us know if we get it wrong, but also please let us know if we get it right. Our staff are really pleased when they get a card or a note or whatever it may be, just to say thank you. So it's those simple things. The community can do so much, and we're here for you, and we'll continue to be so.
That's very humble words from him.
Yeah, but we always talk about the NHS.
Yeah, we always talk in regard, because just imagine one staff handling 10, 20, sick people. It's not just easy. We can't handle just one ourselves sometimes. And a staff is trained, and it's a really appreciable things. And our show time. Pam, you want to add something? Any message you want to give to the audience or to the listeners? There was something I was going through. Mark Simmons.
Michael.
It's okay. The sad is Mark or Michael? I got an email. Mark.
Oh, whatever.
Pam, you forgot her name.
No, you see what I call it happy empathy hour.
Next time you go and give a hug. Go and give a hug to the right person, not to Michael. That's the jokes apart. So that's leading for something that seasonal affective disorder effects, like many during the winter. And we know that snow, tripping and falling and all. But seasonal affective disorder, there is something which I was reading, and affects many people during this winter. And how people can identify and address this condition. How they can identify, first of all, and address.
So as we were talking earlier, I think so many factors come together over the winter period, and we've come to recognize that mental health is so intrinsically linked to your physical health. Seasonal affective disorder, I'm no expert in that. I'm actually an intensive care doctor by trade, but seasonal affective disorder is well recognized as something where people feel low in mood, they feel less willing to go out and do their usual things, and just feel less content with their life over the winter period. Now that does have a knock-on effect on their physical activity, on their willingness and ability to get out and about and enjoy life, because of their mental health. Now, linking mental health and physical health together is something that perhaps we haven't done in healthcare particularly well over previous decades, but I think we are beginning to recognise that it's such an important part of what we do. And actually, it's an important part of winter, because the dark nights and the cold and the rain and the damp, it gets us all down. But there are people who are genuinely unwell as a result of it, and we need to recognise that.
I think, and we're also trying to recognise that in terms of how we create an environment in the hospital where we get people up, get people moving. Particularly, we will have patients admitted that just really are struggling with that, and really trying to encourage them not to just sort of be in bed all of the time, to really try and sit out, get dressed, get moving, and really trying to maximise their recovery period so that they don't deteriorate further. But like Mark says, it affects a lot more people probably than we even recognise, although that's slowly being resolved.
I used to be an activity coordinator that go in care homes and get the people moving and everything else, exercise, even throwing a ball or doing something. You know, I just sold myself to Mark and Tracy. I'm sure I'm on the interview. I'm sure I'm on the interview list.
So I think time I have to take autograph from Mark and Tracy and you as well. It's just
I'll tell you, I'll get it next time when I go and see them. I know where the corner is where I got to go.
Right.
In the Queen's Medical Center.
Yes.
But it was nice. The
Yes.
next one I would love you to come on to talk about as well is diabetes.
Yes.
Because diabetes, especially in our community, the Black, the Asian, the pink, the blue, and everybody. So that's something is not really talking about.
And not aware of so many things like what they can take care of things and all those. Yeah.
So that's one of the things that's what we need to do is take care of everything in ourselves this winter. So if you are a diabetic, maintaining your blood sugars, maintaining the control that you would have in the summer months is more difficult because you're doing less activity and perhaps you're eating those big Christmas dinners, etc. It can feel like a really difficult time to monitor and keep an eye on your health. But it's so important.
That's another topic that we would love to talk about. And
yeah,
also,
but the advances in diabetes in recent years have been absolutely phenomenal. The insulin pumps and the monitors are now so tiny that I'm sure you've seen children and adults playing sport and doing everything whilst their blood sugar is being monitored constantly. You know, it's a very different disease to what it was 25 years ago, and I'm sure our diabetology colleagues would be delighted to have a chat.
Yeah, and the other thing is prostate cancer, please.
Yeah,
we're looking because we don't talk about that, and men don't talk.
We need to have a separate show on this because
that's why I'm booking both of them now
in advance. We need to have a full, complete show on that because we are really running out of time. We didn't realize how the time has passed. It was so nice talking to both of you. And thank you, first of all, for your time that you have taken us time for us in your, busy schedule, the routine and the busy schedule. It's really...
But they were smiling as well. They were laughing.
Yeah, it's because you make everyone smile. It's a happy empathy hour. And Pam makes everyone smile. And we are glad they're smiling as well.
Yeah.
Because that's a big thing with such a hectic schedule and so many responsibilities, duties. They took us the time for us and they are smiling for us as well.
Yeah.
They have a big smile on their
and
face.
that leaves a lot of pressure. So when they go back to work, they'll be scratching their head. You like me scratching mine.
I really highly appreciate. Thank you for your time.
And we do appreciate.
Yes, and we want you to have on our show again.
No problem. Thanks very much.
Really nice to meet you both.
Yeah, thank you.
Yeah.
Thank you so much.
Thank you.
Have a nice evening and take care.
Yeah.
Thank you
very much.
Bye.
Bye-bye.
Okay then. Take care, darling.
Thank you.
Hard to figure it out. I've spent many days lost in myself, drowned in this world, had to reset. I never ever go back to that again. Say I gotta get up and get on my way, leave the negativity way behind me. Say I'll never settle for less. Sometimes it seems that we gotta lose it all before we can see that nothing lasts forever. Risk it all for love. Love is from above, and all my life is for you. So I'ma live it up.
Siempre real y sincero, y sincera la música.
I'ma live it up.
Con amor verdadero, vamos pa'lante. Yeah. Y líbrate la mente, y grita lo que sientes, grita lo que sientes.